would you call Connecticut Children's Medical Center a destination spot? And let me define that, Marty. Destination in the sense that medical people, whether they're clinical medical people or they're administrative medical people, come to you. It's like a great athletic program, right? Where people want to come and play for you. Yeah. Is that the way Children's Medical Center?
It is, exactly. So I'll give you some idea. In the last 5 years, we've seen a lot of growth. We've grown by 30 to 50% in terms of size and number. We've added, Jim, 400 jobs in this economy, not too bad. And those jobs include, the average pay for one of those jobs is $80,000 a year because we're attracting healthcare professionals there. So we brought in about 60 physicians in that period of time from across the country and across the world as the destination for their practice of medicine. And the medicine is for kids, pediatric medicine.
Now, are there any other no, that's the wrong question. Are there any other children's medical centers in New England or the Northeast? I mean, I'm sure there are, but...
Yeah, so I'll tell you, so there's two types of what people would call children's hospitals. One are freestanding, just like us. We're one of 50 freestanding children's hospitals in the United States. In fact, Hartford is the smallest city that has its own medical center for kids. And then there are others that are hospitals within hospitals, so they call themselves a children's hospital within a hospital. And Yale New Haven is a great example of that, and they do great work at Yale New Haven. The other freestanding children's hospitals in the Northeast are Children's Hospital of Philadelphia and Children's Hospital Boston. In Connecticut Children's. Those are the three in the Northeast.
And when you define freestanding as an institution that's dedicated to just children.
Just children, and it's not owned by any other institution. It's freestanding. It's all
Okay, and Marty, define children for us.
Sure. It's from pre-birth to 21 years of age, but pretty much 18 years of age.
So really if you drew me the pie chart that said from pre-birth all the way to 21 years of age, and you drew me that pie chart of population, what percentage, give me the percentages as you move up in the getting older scale.
Yeah, so the good news about kids are healthy for the most part. And kids have a lot of challenges. They do have challenges early on in their lives. So of the kids we see, for example, we have 72 neonatal intensive care beds. These are for preemies, as we would call them in the community. 40 of them are in John Dempsey Hospital in Farmington. We run it, we own it there. And then 32 are within Hartford Hospital because they're right near where the mothers give birth. Obviously, that's where it is. And so today, we have about 145 kids in the hospital. And over half of those are in intensive care. And the average age is 4.
My goodness.
So if I gave you a spectrum, as kids get older, it becomes more injury or disease related, but we have a lot of kids who have congenital issues when they're born.
When they're born. And that's where the neonatal intensive care...
Exactly. And so we have kids today in the hospital that are anywhere from a little over 2 pounds to over 200 pounds in the kids. So it's a huge spectrum.
Now, do you, I mean, are you, I mean, as the chief executive officer there, Marty, I mean, the institution is a large institution, but it's not so large, for example, that you don't get the opportunity to get around in your own medical center, right?
Absolutely. Yeah.
Give us 1 or 2 examples of some of the more extraordinary things you would see if we were in Children's Medical Center now.
Yeah. So right now, I did a tour, as a matter of fact, before I came here and was walking around. We had done open heart surgery on a kid this week and was in recovery, doing extraordinarily well, but a very, very small child that was going on there. Another child I'd mentioned had brain surgery because of an accident that had occurred there. And then in our neonatal intensive care area, we have over 60 kids in that area right now, and I'm truly, they're down to 2 pounds in terms of size. These are kids whose future is very bright, but right now have some pretty significant challenges in their lives. Best thing for me in going around the place is meeting the families that are there. We're a life support for them, the families overall. So while we call ourselves Connecticut Children's Medical Center, we're really Connecticut's Families Medical Center, because kids that come, particularly 4-year-old kids, don't come alone. They come with dads and moms and brothers and sisters, aunts and uncles and grandparents. And so it's really a family place.
You said there's 146 patients there now, but I think your number was. As part of the facility, Marty, do parents like stay overnight there?
Every room's a private room. Every room has sleep-in capabilities for the parents. Every room has its own private showers and facilities there. In fact, in our intensive care areas, we actually have private rooms for the parents. Sometimes you have to get away from the intensity and the beeps and noises and everything. So we have for them in eating areas, we have private rooms for them, we have showers, we have even laundry facilities for the parents and staying there. Parents want to stay with their kids.
Oh yeah,
absolutely.
And the kids want the parents probably to be there.
Yeah, absolutely.
You must see, I mean, when I think of, I don't know, I was reading or saw a program several months ago on the care, the acute care of children. And being a pediatric neurosurgeon is different than being just a neurosurgeon.
Oh, absolutely. Yeah.
Because when you're operating on the heart or the brain of a 2-pound infant, that's a whole new world, isn't it?
It truly is. And so one of the mistakes people think of kids is they're little adults. They're not.
They're not.
They're very special and very special development needs and very special healthcare needs. So we have to have specialists that don't not only do that, but also the equipment to do that.
Yeah, the technology.
So you think of a blood pressure cuff that you would have on you, think of it on a 2 or 3 pound child whose limbs are as big as my little finger.
They can't tell you what's wrong.
Yeah, no, and they cannot
That's
tell you.
I mean, both of us have children, Marty, right? And the toughest part when they're growing up at the younger years is there they are, and you know something's wrong as a parent, but they can't tell you what's
exactly
wrong.
Right, and that's where the specialists come in that we have, both in the diagnosis of it and the treatment of those kids. But we have to have more than just surgeons and physicians and nurses and others. We have to have family and patient care advocates for those kids. We have to have people who have social work backgrounds, who have psychology backgrounds, for the very reason you're saying, because it's not always easy to understand what those
It's
kids
amazing
face.
sometimes, Marty, when you listen to the program, the radio program, and listening to some of the families talk, how we react as adults to the severity of what the child is going through versus how they react.
Sure. I took somebody on a tour earlier today of the hospital, and they came through and said there was no crying. It's a very happy place.
Yeah.
It's very upbeat, and because we're there, people ask me what I do for a living, and what I say is I sell hope. Our job is to turn hopes into realities. Every person, every family that comes into our place have hopes in what's going on, and our job is to turn those hopes into reality. And we do it. And if you've ever been there, it's an atmosphere that's completely.
I haven't been there.
It's completely different than any place you'll ever been before in terms of toys everywhere, games everywhere. The color scheme is completely different than the adult
And that
places.
plays into the psychology of what you're talking about. I mean, the last thing you want is a negative environment or a resigned environment. You want something positive.
Yeah.
We've got about 4.5 minutes left, Marty. All the healthcare reforms that are going on. What's your view on how the healthcare reforms are going to affect Connecticut Children's Medical Center?
That's a great question. I think the ones that were recently passed, the healthcare, what they call it, Obamacare or healthcare reform, one big thing that did for kids there is pre-existing conditions. So you have I have grandchildren now, so you have a child born who have a congenital problem, and you have a job, a good job, but you lose that job in this economy, but your child still needs care. And you go into a new job. In the past world, they might have a pre-existing condition, even though they're going to have that for years. One of the greatest things coming out of this new legislation is pre-existing conditions are covered, so you can go other places with your kids. The good news in Connecticut is we have something called the Husky program. It's a Medicaid program. So if you do lose your job now, you have a smooth transition to that. So kids are not completely impacted the same way that adults are for healthcare reform that are going out there, because so far kids have been had a good treatment programs, particularly in the state of Connecticut. My concern going forward is a political concern and a financing concern, and that is Medicaid is expanding enormously, adding 30 million people to it. Kids don't vote, and kids don't give to political campaigns. Where's the money going to come to pay for that, and what's the impact?
Okay, Marty, so stop. Stop. So I'm going to be President Obama, and you're going to be Marty, and I invite you there for a day. And I say, so Marty, tell me, I mean, you know, all this stuff that's going on with the healthcare upgrades, et cetera, I'm asking you on behalf of children, what is it that you would tell me to watch out for, or something that I need to do in terms of pushing the healthcare out there relative to children? What's your concern, main concern?
My main concern is you can tell kids they have coverage, but if you're not going to pay for that coverage, they don't have access to care. And right now, in the cares we have in the state, the kids, in a city the size of Hartford with 25,000 kids under age 18, there are almost no private practicing pediatricians because they can't afford to take care of kids when they're paid 75 cents on the dollar their cost to do so. My biggest concern to the president is have the courage to provide the care to those kids and the coverage to those kids, but also have the courage to come up with the revenues to pay for it as well.
Yeah, and you know what, Marty, I applaud you saying that, because when you get into pre-existing conditions or some of the other policy outcomes of the program, it's hard to argue with. What people don't focus on, however, is the other end of it. Somebody's got to pay for it.
Exactly right. Right.
Somebody has to pay for it, and that's where the financial and political end of it comes in.
And we duck it. My son just moved to this country. He's a citizen of this country, but was living in New Zealand, where they had universal health care for socialized medicine there.